For the ones of you I haven't had the pleasure of meeting you so far, I'm Andrea Bocca, I'm a dermatologist, and I also work as an international trainer for the industry. My story with Sunekos started years ago when for the first time I sat down with Tiziano Cameroni, who's the heart and one of the minds behind the product, and he told me such a different story. A story of collagen type 4, type 7, fibronectin. So I was like, hold on, what are you talking about? And that really captured my attention, because I was hearing a story that was not about marketing, but it was about science. It was something totally different. And that's how we fell in love, me and Sunekos, and then we just kept on going, because I think we deserve more than marketing. Marketing, each one of you in your own countries, in your own clinics, you can do it tailored to the heart and to the minds of your patients, but science is something we really deserve. This is my QR code. Again, many of you I know, the ones of you I don't know, just stay in touch if you need any of the videos from today. If you have any interesting cases to share with us, one of the big advantages with Sunekos is that professional dietetics, their mind is very open to suggestions, to new clinical indications, because regenerative medicine doesn't stop and doesn't start with just beautification. It really goes way beyond. This is why today we're going to be talking about the body products, and then yesterday with Marco. Marco, are you here? Marco is going to come soon, and I'm sure you already met Marco yesterday, because yesterday it was the talk about the products dedicated to the face, and it was performed on 1,200. Who in the room is already using Sunekos? See, Tiziano, you have many fans there. Who's using the body line of Sunekos already? We have to improve on that one. We have to build up on that one because it's the newest line. So while many of you already know Sunekos Performa and 1200, just know that with the same philosophy, regenerative medicine and potential in mind, we have now Sunekos Cell and Sunekos Body. And Sunekos does stand out. It does stand out for the science, exactly what we were mentioning, that now you have a product who's able, in addition to giving you what everybody else is giving you. So a story of collagen type 1 and type 3 production, which you know they are unanchored, and the architecture, if we just focus on that one, will become profibrotic. Definitely this is a story of anchoring, creating homeostasis, restructuring in the right way. So this is where collagen type 4, who creates the anchoring plex, type 7, who anchors correctly the fibrils, and also fibronectin, who anchors collagen to the surrounding cells, and elastin, created in the right way in an anti-inflammatory pattern, so they're really integrated into the tissue. This is how they can kick in. Because with Sunekos, you do have a biostimulatory effect, but you have it in a different way, by the regenerative pathway, the sustainable way. So anti-inflammatory, anti-fibrotic, universal approach, because this is really suitable for every single patient stepping in the clinic. Because for the first time, you have a line of products who presents to you real data for prevention, meaning you take a young skin, you pre-treat it, and it's gonna age better. So this is mind-changing. And this is why this is really universal. And also if we think of cellulite, it starts in early ages. So now we can be preventive and corrective at the same time. And it's also incredibly sustainable, because I can start it now with a patient who chose me in their 30s, and they're going to become 40, 50, because you want your patients to age with you, right? It's so hard to have fidelity nowadays, to have a patient coming to you and really staying with you. When you manage that, you really want products that don't only give you a nice clinical before and after today, but give you sustainability. Because if I start injecting whatever, you pick the collagen stimulator you want, let's pick PLLA, doesn't matter. If I start it in their 30s, by the time they're in their 50s, the skin is just too fibrotic for me to be able to repeat the procedure. So sustainability we have to keep in mind, because our patients, we want them to go through a patient retaining system and stay with us. And it's not only for the face, it's also for the body with the exact same concept in mind. Hot or not? It's all a matter of taste. You're right. I give you the right on that one. But definitely could be improved, right? Now let's shift the perspective. She's hot, right? So it's all a matter of having a beautiful face, but not a matching body. Definitely, when we talk about beauty, it goes from up to down. So this is where we maybe want to change the focus. How many of you in the room have a business focused on the face? Whose business is focused on the face of the patients? Let's see if we improved throughout the last year. How many of you are focused on the body? 1, 2.
Face and body.
Face and body. How many of you are both? So you have very little competition. I'm happy for you because you're addressing a market with very little competition. So there it is. We improved a little bit. I think last time in IMCAS when I checked it was only 3 hands, so now we have more people. This is because the body market is a drastically increasing market. And if you think about it, is the same lady who's coming in for Botox, she will have cellulite. So this is why it's not about going hunting for new patients. It's just talking to the patient who already chose you as their trustful physician. Let's focus. Let's see, do you have the right focus? What was written on her shoulder? Who saw it? Nobody, guys. We just changed the position. You forgot it. Cellulite, right? Okay, let's try it again. Focus. What was the color of her bracelet? Black. Ah, see, you're improving the focus. So as time goes by, we improve the focus and we learn to focus on more aspects of our patients because that's how we expand the market. And it's not just about economy, but it is really providing the same thing, life quality to our patients. Because in the end, many people say, oh, you do aesthetic medicine. It's like you're selling apples, right? Is this medicine at all? Who's dermatologist in the room? Why do you treat acne? Did it kill anybody? No. Life quality, right? Why do you treat alopecia? I mean, it's not so cold to be bald, right? But there we go. So why do we treat it? Because some people want the hair. Why do we treat vitiligo and so on, so on, so on? So life quality is a main indicator, and now it's shifting even in cardiology. Before, it was all about survival, and it was all about how many years you live. Now it's all about life quality. How do you choose to live those years? So when I feel better about myself, and when patients feel they're more beautiful, this is what we're giving to them, life quality. And there's so much published data on this one. So it's not just about economy, but it is true, real depth medicine. And let's think you have 10 patients in a day coming in the clinic. What are they most likely to ask you? Why are they coming to you? You know the song, Say Something.
Botox and lips.
Botox. How many will, if 10 people go by the clinic, how many are likely to ask for Botox? Here, an 8, a 7. What else can they ask for?
They just want to improve the skin. They just don't come with something to say.
Also skin. These are the actually real numbers from the published data we have, mostly from the Americans, because they do count their money. So most likely 4 are going to go for Botox, not just ask, but actually go for it. And 2, 3 for fillers from 10 random patients. But now let's shift a little bit the focus. 9 out of 10 will have cellulite. So you see the marketing potential, and it's the same people coming in the clinic. Of course, they say it's a fair world. 2% of male patients have cellulite and 9 out of 10 ladies. So yes, it's more of a feminine marketing, but even aesthetics right now, it's still focusing a lot on the females. Actually, the male population is 17%. That's the archetype, the male patient, 17% of the people we're seeing. It's a growing market, but yet cellulite, let's think about all the females. You have 10 ladies in your clinic, 9 will have cellulite. And it is a chronic condition, because this is another very strong point. It's a chronic parapathology, so think about it. It's just like aging. You're not getting rid of it. It's not a one-time shot like you're putting breast implants and it's done. No. As long as you educate them and they understand it's not something you're getting rid of. You're maintaining and improving a condition which is very similar to the aging process. The sooner you start, the better the results, and it's never going away. Now, of course, life factors are included and it's a plurifactorial image. But if you look at the market, it's increasing drastically. The forecast for the next 10 years, look how good it looks. And the market globally from 2.2 billions is shifting by 2032. It should reach more than 5.5, so more than double. So it's really big. And you, where do you stand? It's so little of us doing it. But you know, it's weird, okay? If 9 of 10 ladies have it, if 10 people enter your clinic, how many will ask for cellulite treatment? 0, there you go. Why do you think it's 0? Yeah, shame is one option, okay. Why else?
Maybe sometimes they
Don't believe in the
don't know
results.
we treat cellulite.
Because many times they don't know you treat it and they don't believe in the results. This is the plurifactorial image we are facing nowadays. And this is the why. Because by the time they got to you, they already scanned it out and they already asked ChatGPT for the best cellulite treatment, and then they tried already creams, massages, bamboo sticks, a little bit of Vela shape and everything with very minimum results, so 10% very high satisfaction rate. Why? Because this is what they're doing. And it's also because some of the treatments we thought were very efficient, they're not giving the answer we thought, such as subcision, which is quite invasive. And it's not giving the effect we thought because it's not getting rid of an anatomically normal positioned structure. And because of this, actually they spend a lot of money, around €1,000 looking for a solution. So it's not that they don't want to put the money. No, they want to put the money. It's just they're not getting the promised results, so they stop believing. Plus, exactly what Natalia said, they don't know you do it because they trust you. That's why they're in your lobby, because they trust you. And look, if they could get rid out of something from their body concerns, whatever, stretch marks, everything, number one concern, cellulite. And they say, yeah, but in countries like Middle East, they're telling me it's not a big market because they don't go out naked. You don't go out naked to see your cellulite. You look at yourself in the mirror and you don't like it. That is why you need treatment for it. Now, the big problem is promises. You like these results? They look very promising, but we are physicians. We know that whenever they promise disappearance of cellulite, there is something wrong about it because it can never fully disappear. And this is a beautifully published article. I showed this to you before. Remember, playing with the light really helps. It doesn't help at all. It sells unrealistic promises. And this is the problem. They thought this was possible, so they come to you telling you, oh, I want to get rid of it. It doesn't matter how much it costs, just get rid of it. You can't. So you have to educate on cellulite. But their perceived idea on injectables is always it's more efficient, it gives higher satisfaction rate, they want to put more money into it, but they just don't know there is an option, they just don't know you're doing it. So this is something you have to work on. Let them know you have something in there for them. Because now science is there, the product is there, but you need to open this market. Because it's a market by presenting, not a market by demanding. They don't come in asking for it, you're right, because they don't know it's there, they tried, they didn't get it, they're not believing. So for all these reasons, they're not coming in asking for it. But the moment you start talking about it, the moment you start showing before and afters, they are coming. Because look, life quality impairment with cellulite is really interesting, much higher than we thought. I mean, it's just some dimples, and everybody has it. More than 90% of patients have it, right? A female patient. So why they want to treat something that almost everybody has it? Aging, everybody has it. 100% of us were going to age, and yet we want treatment for it. And this is severe life quality impact for 25% of the patients with cellulite. And look at the numbers. 80% of them, they complain of self-esteem issues, social avoidance, even 50%, most severe cases, depression. So with these numbers in mind, almost 70% of patients are constantly seeking for an option, and only 4% couldn't care less. Everybody else wants an improvement, wants a solution, wants to know about it. And also now we know more about it, because remember in the past, cellulite was drastically associated to fat, right? It was chubby ladies have cellulite, skin ladies they don't, and now we know it's not a reality. And now actually we know that cellulite is about extracellular matrix dysfunction, chronic inflammation, and deficit in angiogenesis correct potential. So now we know it's about the veins, the lymph drainage, the inflammation, and the skin. Now, of course, with this in mind, we have to understand that the treatment options that work mostly by inflammation, they're not giving you what you want, logically, because already it's about chronic inflammation. So you might get immediate results, but not sustainable, because you're actually worsening the inflammation, which is one of the backbones of cellulite. And now we know that the real thing lies into the skin, because you have fascia superficialis. Under it, fatty lobules are fine, they're oval, they're flat. Above, polygonal lobules, they herniate into the skin. But why they don't herniate with people without cellulite, and they herniate in patients with cellulite? because of the skin. So now we know that there's metalloproteinase 14, main local collagenase, in too much amount, elevated levels, destroying the normal collagen architecture. And then there's fibrillin 3, a very nice glycoprotein, which is depleted and very closely linked to elastin. So we have abnormal collagen structure and lack of elastin. So the skin is pretty much like an aged skin. So fatty lobules, they can herniate. Of course, bigger the lobule, bigger the herniation. But it's not because of the fat, it is because of the skin. And also, if we look at it with high-resolution ultrasonography, with high precision, good devices, we can see it. You can see the fascia superficialis, you can see the deep fascia, and you can see the areas of edema. And you can see the fibrosis, the whitish parts in between. So now we know pretty much what is inside. And you also understand that this fibrosis that you're seeing, it's just normal fibrosepta that they divide the fatty lobules. They are stronger than normally, so you see a little bit the dimpling, but they do belong there. So it's like the zygomaticocutaneous ligament. You try to subside it, immediately you say, ha, I did it, and then guess what? Logically, it's back. So it's pretty much the same problems that we're facing. This is why when you look at imagistics at it, aggressive subcision is not going to be your tool. Neither will the other pro-inflammatory options be, because this is cellulite. Depending on the stage, this is the reality, the pathophysiological mechanisms within, depending on the stage. And this is why we have to be aware that by the time we have stage 4, sclerosis, which is irreversible, is already in there. Of course, everything else can be improved, but sclerosis cannot. This is why you have to start the treatment in time by restructuring the extracellular matrix, reducing the inflammation, decreasing the degree of fibrosis, neutralizing the acidosis that you have within, adjusting the angiogenesis, and putting it all together. Depending on the stage, it will help every single time. And this is why we have Sunekos Cell. And as the name says it, it is for cellulite. Now, in addition to what you're used with the normal Sunekos products, in this big vial, of course, you have the low molecular weight hyaluronic acid. That's the real particular type of medical-based hyaluronic acid, non-cross-linked, but low molecular, really high purity with closed telomeres that you have with Sunekos, mixed with the amino acids, the patented 6 amino acids that are strongly anti-inflammatory. And then to it, you have an addition of a 5 ml vial with a carbonate and bicarbonate. So now you have an injectable medical device with therapeutic indication, not only aesthetic indication. Why? Because each single ingredient gives you a medical approach to cellulite. So for example, the low molecular hyaluronic acid, strong stimulator of the CD44 receptor, so rebuilding the ECM. Then it even goes further because it does stimulate also endothelial receptors, so angiogenesis happens. And then the amino acids, they're so particular because they are anti-inflammatory, they are hydrophobic, so they will push water away, different from the hyaluronic acid, which tends to retain water. And also, they cluster around the AJ molecules, and they create like a shield, protecting it from the effect of the hyaluronidase, decreasing by 40% the hyaluronidase activity. So giving time to the hyaluronic acid to create also those particular types, collagen type 4, type 7, fibronectin, elastin, all of this, and time to integrate it into the dermis. And then you top it up, of course, with the antifibrotic activity of collagen type 7. Then you put in carbonate with bicarbonate that ensure immediate but also long-term release to taper the acidic pH you have within cellulite. So now you have the right product, but you must also have the right indication. Cellulite. Cellulite, but not the fat. Remember, it is not for fatty deposits. So talk to your patients, see their primary concerns. Because this patient might be concerned with cellulite, but she might also be concerned with the hips. So understand them, because Sunekos is always indicated for cellulite. Start as early as possible, but remember that if it is a matter of fatty deposits, liposuction, lipolytics, and then fibrosis is left behind, but then you have to add Sunekos. So Sunekos is a big help also in combined treatments when you're dealing with localized adiposity. But the main concern, cellulite. And cellulite is not lipedema. So make sure you have the right diagnosis. And in late stages it's very clear, but the initial stages, they might overlap. Of course, in both you have fibrosis, you have inflammation, you have androgenetic dysfunction, so Sunekos will help. But with the lipedema, it's mostly a matter of fat, so you will have to bring in lipolytics, liposuction to get a real result, and then Sunekos to solve the other problems. For cellulite, in every single stage, you have the indication of Sunekos. But of course, the sooner you start, the better it is. Contraindications, you know them by heart, they come from the industry, from regulatory, they will be the same with any injectable product. And the side effects talk about the safety of the product. The only thing you can have, a little bit of bruising, swelling, redness, discomfort, but that is it, because it's totally biomimetic. It works in synergy with the body. Ischemia, nodules, granulomas, late onset inflammation can never be there. This is actually antifibrotic, anti-inflammatory, so it will give you exactly the opposite. Now, how do we inject and how do we work for it? Combining the two vials will have 15 ml of product, 7.5 for every side. And those 7.5 you'll divide in 3 areas. Always the trochanteric area, and you pick 2 more with your patient. Sometimes they mind the front part because they can see it, sometimes it's the back. Of course, you can start with 2 vials, but then when price goes up, expectations go up. So you might want to start with the biggest areas of concern. Then when they see results, you become more trustful for them. They get more trust in the product. So then it's easier for them to expand with the other areas. Remember, it's a protocol because this is regenerative medicine. So we need to repeat the treatment pretty much every 3 weeks. And you need at least 3 sessions in the initial stages and at least 4 sessions in more advanced stages. Because you need to repair, to rebuild, and to maintain. We need to really regain the activity of the fibroblast and fix and improve a totally affected tissue. So this is why we need a protocol, and this has to be very clear to the mind of the patient. And then obviously you have to repeat it because it's a chronic parapathology. So normally we repeat it every 6 months. Correct placement of the product will always be subdermal, scratching the dermis from below. It's going to happen. Ha! There we go. So placing it subdermally will ensure that you're targeting also a little bit the softening of the fibrosepta, but mostly dermal impact. So there is where you want your product to be scratching it. So really, really targeting deep dermis and spreading it in between. Not because of aggressive subcision, no, because of depositing the product in the right plane. So 22, 23 gouge cannulas, long ones, 7 centimeters. So that one area you can cover from a single entry point. Think about your hand. You enter with the cannula here and you follow each one of your fingers. Every area will get 2.5 ml of product. So every line, pretty much 0.5 ml. Use 3 ml syringes, load them with exactly 2.5 ml because the cannulas are big, and if you use big syringes, you're going to run out of product. You're going to put too much product in a line. So for easier administration, remember 0.5 for every single line. And ultrasonography is really interesting because it allows us to see where we are. So we have the superficial fascia, the deep fascia. We have the areas of fibrosis, the dermal epidermal complex. So a little bit you can see everything, but do you really understand this stuff? How many of you are good with ultrasonography? 1, 2. We're not doing very well, right? Don't worry, I'm not very good either. But now, look what we have. We have the AI helping us. So now there's AI telling you hypodermis, muscle, bone, filler. So now this is a game changer because now, sorry, I'm going to start it again. You see, I'm seeing in parallel what I'm seeing in the skin. So it's easier for me to recognize structures. Because listen, edema is just a dark area. Is that edema or is it that filler? Filler, if it's AJ, is also a hypoechoic area. Fibrosis, is that the fascia? This is edema. Is that the fascia or is that, welcome? Or is it a fibrosepta? They all contain a lot of collagen, so they're all white. So now with the AI, it's much easier. Because listen, when you inject Sunekos, you don't need AI. It's very safe, very easy to inject. But in many cases, I know you like combining, not in the same syringe, but in the same patient. And when you think about collagen stimulators, there you can have nodules, and especially if you go too deep and you're on the fascia or on the face. When you're on this mask, there can be encapsulation of the product with nodules. And it's a very nice idea to combine, because if you use PLLA or CAHA 10 days after, when you created scaffold, a lot of collagen type 1 and type 3, now you need to anchor it. And this is the time to put Sunekos to work. So Sunekos as monotherapy, it's amazing. If you want to combine it, it gives you also a lot of strength. And you can also combine it with devices, with liposuction, which will leave behind what? Fibrosis. And Sunekos is strongly anti-fibrotic. But of course, in these cases, for example, if you want to do CAHA, you want to be sure that you are subdermal, because if you go deeper, you can have a lot of accumulations. But also, if you're too superficial, you can have accumulations and see the product. So the correct depth is very important for some administrations. But not all of you will have ultrasonography in the clinic. So you'll think, okay, did I do well enough? Will I have fibrosis a lot coming? Just use Sunekos 10 days after your collagen stimulators on the face, on the body, everywhere, because it's going to make you become more efficient, but also much more safe. And ultrasonography now with the AI, even kids can play. She's my daughter, she's playing with it. But the devices, they're not cheap. So you want easier option for you. Just every time you do a collagen stimulator, 10 days later, top it up with Sunekos, face, body, everywhere, because you're becoming safer, you're becoming more efficient. But do you really need it for the body? Look, this is just Sunekos Cell on its own, before and after. And this is only the standard protocol. There you go. There you go. High-resolution ultrasonography will show you that it's really a game changer. You have much more collagen, much more elastin. And this is beyond pictures, because sometimes pictures are not very relevant. And this is lower slab, lower echogenic band has been improved as well. So it's anti-aging, restructuring every single time your skin without any risk of nodules, granulomas, and no thought of ultrasonography either. So very nice results, but I want to get rid of it. With collagen stimulators, devices, or anything, can you ever get rid of cellulite? Never, of course, we're just improving. So remember, you can be safer, more efficient, and more peaceful with the right direction. Of course, you need the right indication, and of course, you need the patient to understand it's a chronic parapathology, so you need to repeat it. But this is really creating patient retaining system in your clinic, because they're coming back, and they increase life quality for your patients, exactly like you do it for the face, you can do it for the body. Just you need, again, to open the market, to talk a little bit to the patients. And it's not only cellulite, it's all the other issues of the body, and for that you have Sunekos Body. As the name says it, it's for everything else connected to the body. It's a 10 ml vial of low hyaluronic acid, non-cross-linked again, and separate you have the powder with the amino acids, the same patented amino acids. A little bit of shift in the quantity of both, so more adapted to the body. So some people say, I'll inject it on the face. Don't, you're going to see a little bit of too much inflammation, because it's for the body, which is not identical as skin to the face, different skin. So stick to it to the body, to these amazing indications. Stretch marks. A lot of patients, young and elderly, they have stretch marks, and it works both for red and white stretch marks. Skin laxity. All the ladies who underwent pregnancy, all the ladies who are aging, all the skinny ladies who lost weight. So it's a big market out there, and you have the same excellent profile of safety. So every single time, efficacy and safety will merge. Just mix the two, you'll have 10 mLs. 10 mLs will cover a big open hand area. And remember, it's a protocol because it's regenerative medicine. So 4 sessions, every 2 to 3 weeks, more likely 3 weeks, give it time to the neocollagenesis to happen. And the same administration you were doing and the same application you were doing with Performa on the face, you'll do it on the body. So you'll be depositing 0.1 boluses pretty much every thumb apart, 1.5 centimeters approximate. And you'll be going perpendicular to oblique to the Langer lines to create anchorage, tension, and restructuring in the skin. So this is what you want to do for any area of concern on the body. So you can be creative, knees, elbows, really literally everywhere. You take the 4 millimeter needle, oblique direction, you put it all in the skin, you're pretty much 1.5 to 2 millimeters into the skin, and there goes your bolus, 0.1 ml of product everywhere. It's a 5-minute treatment, it's nothing, it's extremely fast, And at this depth, it's comfortable. You don't even need numbing cream for this. Arms, everywhere you think, it is the same administration. You just follow the longer lines, go perpendicular to them, one bolus every thumb apart. And remember, repeat the sessions pretty much every 3 weeks, 4 sessions. Every area you can think about. Is this the indication? Obviously, this is Photoshop. What does Sunekos do? Rebuild skin quality, not remove skin quantity. So our biggest enemy is wrong expectations and wrong diagnosis. Because the diagnosis is skin excess, not skin quality, right? Quantity, no. Quality, yes. So this is the correct choice for you. But look at the drastic change. So it's a very nice result, but again, choose it well. The previous cases, they can go through tummy tuck, through abdominoplasty, and then they also need to increase skin quality. Because also if you remove quantity, you don't fix the quality. So it's also nicely synergic after abdominoplasty. So the cases for abdominoplasty should do that, and then Sunekos. But this case is drastical improvement. Look also at the upper part, and look here. So very nice results, but we need to choose the right cases. Also for the hands, if there is huge loss in fatty tissue and muscle tissue, it's all sagging tissue, and that's not the indication. This is the right indication, skin quality. And it will work every single time for every indication you can think about, including stretch marks, this really big promising market. But again, are you seeing a lot of patients with stretch marks coming to the clinic? Not as much as we want. Why? Because they tried creams, the big promise of the market, and it didn't work. Also, you're using devices, right? What are you using? CO2? Fractional CO2? Okay, if you use CO2, what is your biggest risk? Post-inflammatory hyperpigmentation, exactly. Now, what is the advantage of Sunekos? Anti-inflammatory. So again, see the potential of combination, but see also the potential of monotherapy. Because Sunekos on its own, placed superficially, very small 3 microbolus is retracting around 0.02, but literally you just press the plunger and you retract. Just press the plunger and retract throughout the whole stretch mark. And there we go. Sessions to be repeated, the easiest administration, absolutely 0 risk. But for stretch marks, do apply numbing cream before, because you apply it at a much superficial level. Red stretch marks, follow the arrows. White stretch marks, deep broken tissue. Do they ever fully disappear? Of course not. We know it is stretch marks. Do they get improved? Every single time. Predictors for improvement, patients who are photo-aged, burned skin by the sun, and who are full with stretch marks, they improve with more sessions. Why? Because genetically, initially, and then under environmental exposure, you sort of killed many of the fibroblasts, and the ones that are still alive, they are poor genetically in being able to build collagen and elastin, and we depend on the fibroblast. So those patients, like a lot of the Asian ladies, they're full of stretch marks, know that that's a poor responder, because genetically their skin quality is not what it should be. Their collagen and elastin fibers, they're weak, and their fibroblasts are weak in ability to respond. So it will work, but less than for other patients like you've been seeing. Now think about this one, huge market out there. In the States right now, they're talking about 5% of the population under GLP-1 treatment. Supposed to double in the next 5 years. So think how many patients. Europe is talking about 3%. So a lot of patients, and you're sure this is going to happen, because you can't lose weight without sagging tissue. Of course, it's skin excess as well, but it's a lot of skin impairment. So these are cases where you must think also about preventive treatment, because you're sure they're going to end up badly. So the moment they decide they're going to start on the treatment, on the GLP-1, you have to convince them that they need to do something about their skin as well. Because not everywhere you can fill your body with scars by removing skin excess. So at least the skin quality, make sure you improve it. So there's a huge financial impact, big life quality improvement, but we need to educate these patients that the same people who come in for face, they have a big body down there. So for us, there's gain. For the patient, there's gain. Think that by the moment, let's say every day, one patient who comes to your clinic, you talk to them about Sunekos for the face or for the body. It doesn't matter. It can be skin quality for the face, it can be cellulite, it can be stretch mark. 1 patient per day, well educated, in 200 days, in between only toxin and Sunekos, 8 hours a day, you're fully booked. Make the numbers. 8 hours a day, fully booked with 200 well-educated patients. Of course, we're not going to do one every day, but it doesn't have to take 1 single year to be fully booked with Sunekos, because in addition to that, you do fillers, devices, and so on. But think at the huge market potential you have out there, because this is chronic patients who want to age better with us. So this is regenerative medicine. This is like your relationship with your dentist. If you stop going for many years, it wasn't helpful enough. So pretty much educating the patients on the power of being preventive, on the power of repeating treatments and understanding how we age is the biggest thing. And the body is a big increasing market. But in order to waveboard, you have to start when the wave goes up. By the time all of your hands will be up when I'm going to be asking how many of you are doing body treatments, you already have a lot of competition in all of your areas. So start with time, be market openers. I have a very dear friend, I like talking about her a lot in Peru. Her business is focused on cellulite. They call her the Dr. Cellulite. She built an empire on treating cellulite. Why? Because she spoke about it. She told people about it. To whom? To the same patients who are already going to her for fillers, for toxin, for skin quality. But of course, we have to be wise about it. We have to use the TVs in the lobbies that we have to use leaflets, we have to use the social media to talk about the right reasons and to open. Think about giving them papers during the consultation. Think about giving them papers before the consultation when they wait in the lobby waiting for you to be ready. And ask them, I want to know more about cellulite, stretch marks, abdominal laxity. And when they come in with that paper, say, oh, so you're here for dermoscopy to check the nevi, okay, welcome, or you're here for toxin, but I see you're also curious what you can do about your cellulite. So these are your best patients because they already chose you. And remember, the World Health Organization tells us, healthy is not just the mere absence of diseases, but a complete state of well-being, physical, mental, feeling good about you and your face and your body, and so are our patients. So this is what we're doing. We're making them healthier every single time. And I know that many of you in the audience, and there's also a lot of many colleagues throughout the world which are highly expert on Sunekos. So we did something different this year. We asked them to send us cases before the Sympo, before and after, nice pictures of their results, so that you see not only I'm getting good results because you see my cases, but so that you see cases throughout the world, and we promise them an award to the best case, and you're going to be the jury this time. So we got many cases. We picked the best ones in terms of correct images to have what to show you, not those ones playing with the light or squeezing and releasing. And there you go. First case from Japan. Dr. Sai got 3 sessions of Sunekos. I love this video because sometimes pictures are not clear enough. And now let's try to play them in parallel. There we go. You see the clear improvement. 3 sessions. Now a case from Spain. Dr. Maika, 3 sessions, clinical pictures before and after. Then from Albania, Dr. Anila and Dr. Alisa, only 2 sessions. Then another case from Japan, Dr. Kumiko, 4 sessions. You see how the laxity is also improved, not only the cellulite. Skinny patient, cellulite is there for everybody. And then from Spain, Dr. Ramaraznova. Oh, this one is hard to read. 3 sessions, before and after. See the dimples on the butt area, how much they improved? And there we go, another case from Japan. Dr. Atsuko, 3 sessions and also assessment with the live vis. The more devices for better assessment and more objective assessment you use, the better it is to communicate it with your patients. Because this was a case where it wasn't so visible clinically, and yet with live vis you see much better the improvement. And now these are 6 cases, and we want to ask your vote to pick the best case for this year, and we're going to repeat competition so that we get more of your cases together, because I know you have many brilliant pictures. So let's see, Abs is going to help us on this one.
So we're going to do this by raising your hand. If you'd like to vote for case number 1, can you pop your hand up now, please? That's very good, isn't it? If you'd like to make case number 2. Number 3. The CEO of the Albanians.
Correct. You have to support them.
Number 5. Number 6. I think that's pretty clear, Andrea. It's number 1.
It was my choice as well, because you see what we learned from this. Not only that now we have a winner, and it is from Japan, Dr. Saiga. And I know many of the doctors from Japan couldn't travel because of the situation. But now again, Tiziano make a video of this. Our winner is Dr. Saiga.
Wait.
Go. Our winner is Dr. Saiga with a big majority of votes. Let's give the doctor, let's send him virtually an applause. But we also learn that videos and imagistics can really help us. So we have to be clever, more clever on how we show the before and afters, because that's such a clear result. Maybe just the pictures wouldn't have been so clear. So there we go. Now we have a winner. And Tiziano, definitely you have to send the boxes all the way to Japan. Yeah. And with this being said, yeah, okay, we trust you. And with this being said, they left because always I put images of Romania. I'm hoping that the Ministry of Tourism in Romania will give me one day an award for bringing international visitors to Romania. You're more than welcome. It will be my pleasure, my honor to invite you to Romania, where you can discover how you can become immortal, because Dracula is from Romania. And now I'm pretty sure that the last visitors, which are the doctors from Argentina, we have many of them there. Thank you for joining and for coming to the clinic. They already visited us. We get many visitors from everywhere, so it will be our pleasure to welcome you and dive even more into Sunekos. You can also visit in Milan, Professional Dietetics, and the headquarters, because Tiziano, I would like to invite you also to say a few words from your side, because I didn't talk much about Professional Dietetics, because having you here, I mean, who's better to talk about it than you? So with this, thank you so much, and I give the word to Tiziano Cameroni, the CEO.
Thank you for joining us today. I don't know if the microphone is working, but anyway, my voice is loud. So, thank you for joining us today. It's late, we know, it's aperitif time, so it will come soon. And there is also a gift for you, because you have been here attending us. Just a few words about us. You know us because of aesthetic medicine, but we would like to tell you that we are more than aesthetic medicine. We are a pharmaceutical company founded in 1996. So this year are 30 years that we are doing R&D in medical. So our experiences come from therapeutical use of our products. So we have 2 lines of research, just for your knowledge. We are in 1 line developing clinical nutrition, where we are treating metabolic diseases and so on. Then we have a 2nd line of research that is focusing on tissue regeneration. But before coming to aesthetic medicine, our expertise started from advanced wound care, where we are in neonatology, we are in diabetic foot, we are on many diseases related to wound care. We are in cancer supportive care, we are in oral surgery, we are in gynecology, and soon you will see a new product. So it's already available in gynecology, but you will see soon that it will be well distributed. Sorry, I'm tired. And I mean, this is just to tell you that it's not just because of, we're not just talking about efficacy, but we're talking about safety. Safety for us is coming first. Quality of the raw material, all the research this is behind, everything is coming from severe situation. And we decided to bring inside aesthetic medicine the same level of safety that we are having in our therapeutical areas. This is because you deserve to have the best results, of course, but you also deserve to have a safe product in your hands. So, what else should I say?
I believe that honestly we don't have just the industry, we have a partner in professional dietetics, because whatever we say, oh, we would like a product for hair, for androgenetic alopecia, and they took and they said, okay, we'll look into it. So every idea that you come with can become a very valuable tool, because although already their previous version was amazing, Sunekos 200, they didn't stop there, they keep evolving, and they gave us an even better version, the Sunekos Performa. So with professional dietetics, it's 30 years of every year becoming even better and better. And this is what we deserve, also to become better and better each year. So thank you for being not only a partner, but also we feel part of the family, because they take our feedback seriously and we belong. Now we are all, each one of us, a small part of a professional dietetic family. And thank you for being the real proof and being so late today with us. And well, we'll keep you posted on all the news that are coming, and bring the body and the cell also back home with you, because you know you already love Sunekos Performa and 1200. Thank you all.
Thank you. And before leaving for your this well-deserved aperitif, please, we have a gift for you. There, you can try these products on yourself or on some of your best friends. Okay.
Thank you.